Please share my screen. Right. Okay. So it's wonderful to be with you today. There's going to be myself, Eva Gahaya from McGill University. Temu, your mic. Your mic.
Sorry, my mic was on mute. Hello, my name is Teemu Santonen and I come from the Laura Applied Science University from Finland.
And Tamás.
And hi, I'm Tamás Tóth. I come from the Wellbeing Living Lab in Nagykovácsi, Hungary.
Wonderful. So I begin, and well, here we are, although you can actually see us. But if you go back to the slides, you can see us again. Here's the agenda for today. We've just introduced ourselves, and today's main topic is formulating a research question, looking at research planning and selecting research methods, and then Tamás finishing with practical insight for qualitative research. Now, what we would like to do, other than our presentations, which, as you can see on your screen, each section is followed by a question answer period. So we invite you to put questions on in the chat. We will be monitoring that, and after each section, we'll stop, see if you have questions, try to answer them, and then move on. At the end, what we would like to do is put you into breakout rooms. Depending on how many you are, there will be 2 or 3 breakout rooms, and we'll tell you, the basic idea is once you have heard about general principles on formulating a question, and then you've also heard about research methods, qualitative, quantitative, mixed, or other. Then the idea will be that in each breakout room, you will discuss amongst you and come up with a research question, one you might already have, because some of you are already working in living lab research, or you can come up with a brand new one. And then look for come up with a method that could help you answer that question. You will sit in these breakout rooms for about 10 minutes. That gives you enough time to discuss and come up with a plan. And then we'll bring you back to the main room so that you can tell us about what you discussed, and we can look at it together, ask questions, give suggestions, and that's how we close. Any questions up to now? No? Okay. So we start with formulating a question, and actually before we do that, you have, I think all of you have been following the different webinars. So you have already been exposed to living lab research. Our center are the users, always, whatever these users might be. And then different components gravitate around them. The researchers, industry, community organizations, administrators, clinicians, if you're in the healthcare system, and of course, all public-private organizations. Now, in my case, I work in healthcare, and our center are persons with physical disabilities, persons who come to our rehabilitation centers. And so they are the center. And the goal of rehab, among other things, is to bring people to actually return to their whatever previous life they had, to the extent possible, to realize their objectives. So we move out of the rehab. People come to the rehabilitation center, stay for about 2-3 weeks, sometimes 4, maximum 4, and then they move out. And where they move out, they will, hopefully integrate the community and want to resume shopping appointments, leisure, arts and culture, sports, work, school. We know very well that that is a difficult process, and that's where Living Labs can actually help with the help of public-private collaborations. The researchers are there. Industry and technologies, they will come up with different tools that will help them reach their goals, working closely with community organizations and with the users, always at the center. We have a sense of moving together towards achieving their goals, which become a common goal for Living Lab users and and persons in this case, persons with disabilities. You also see administrators and personnel, and our goal is essentially how can we enhance mobility, facilitate transport, enhance communication services, provide adapted activities in adapted spaces. Gives you a general sense. Now, oops, no. So I see somehow the PowerPoint decides to move all on its own. So I'm going to have to, that's not very good. I'm going to stop share for a minute. Apologies. I can start talking about the research question. I have to go back to Temu. No, never mind. I'm going to do it myself. No animation. Maybe that will work. Okay, we'll try again. So when you're thinking, when we're doing Living Lab research and thinking about our research question, one of the very first things that we are going to ask is, what are the main ingredients as you're thinking about a research question? And in fact, as you're thinking about the breakout rooms that we're going to have later, you may want to contemplate this. So our question is, you know what? If you don't mind, I'm going to step out of presentation mode and we'll leave it like that. So the main ingredients of the question. Well, the first question is, who are you addressing? Who are you interested in? Are you interested in children, in the community, living in homes? Are you interested in families, in patients, in community organizations? So that the who is the number one. Then the next one is, what do you want to know? Do you want to know about, and I will give you examples, do you want to know about how, for example, persons with disabilities enter a space and whether they can participate, whether a space is inclusive? Do you want to know whether transport is accessible and inclusive of persons with disabilities, and so on? Then, of course, the question is, what do you want to do? Do you want to inquire about what's out there? Do you want to know what their people's experiences and desires are? And of course, importantly, you want to know what gap does your question address? For example, we know that transportation can be difficult for persons with disabilities. We know that there are certain adaptations. Are these adaptations used? Does the transportation company encompass these adaptation? Specific example. Are there gaps? What needs to be addressed? And then, of course, what are the possible outcomes and deliverables? These are all the things that go into the thinking process of as you prepare a research question. And now, here are the potential examples. So what do you want to know? Do you want to know whether persons with physical disabilities can easily enter and integrate? This is the Museum of Fine Arts in Montreal. And all the examples that you have here and the photographs are from actual projects that have been running through our living labs. And then once they're in the museum, can they move easily? What are changes that need to be made to improve accessibility and inclusion? In the rehabilitation center, you may want to know whether people who have suffered a stroke and have aphasia or language difficulties, whether they can actually resume walking in the environment safely. So are they able to walk? So this is what you're seeing here is a virtual environment that shows an urban sidewalk and a person who is walking on the treadmill and also looking at words that appear on the screen. Walking in general is a multitasking event. So can persons with stroke reintegrate safely the walking in the community? Well, before they do that, we work with them in a virtual environment to make sure that they indeed can actually resume safe walking in the community. Here's another example pointing to a person with stroke who is actually exercising and looking to see what we are looking to see is whether exercise can improve cognitive capacity and language performance. And then moving to artificial intelligence and looking at ways to facilitate communication for persons who have suffered stroke, traumatic brain injury, or persons who have degenerative diseases and neurological conditions, and looking to see whether we can find ways for them to communicate more easily using artificial intelligence. We know that there is a gap. So in each of these examples that I'm showing you, there are gaps of knowledge. And so we're moving into these domains precisely to try and find answers. So I've talked about what we may want to know, or what do we want to do, and what are the research objectives. Well, when we started working at the Rehab Mall, which is a project that took a shopping mall, worked in a shopping mall to change it into an inclusive environment for everybody. People with disabilities, mothers with strollers, uh, persons with shopping carts, anybody who might have difficulty, who might be holding all kinds of things in their hands and have difficulty moving around. When we started the project, there were, and this is what I'm showing you here, there were 6% of elderly population entering the mall. I'm not even saying 6% of persons with disabilities. Well, there was good reason for that. When we observed. And so who enters this mall? We also saw that there were only steps. There were no ramps, no easy accesses to the inside of the mall. So what we wanted to do is work with the owners of the mall to make the space more inclusive. And at the end, in 5 years later, there were 23%. I can tell you that today, this is a few years ago, today there are even more people with different mobility difficulties who are entering this space precisely because of what was done. Another thing we may want to do is use different technologies and try to quantify performance of persons entering specific spaces. This is the case of the Museum of Fine Arts in Montreal. We know that entering a museum, being in a space where there is art, can actually improve well-being of individuals. Sometimes it can improve their language output, their cognitive output, but we know this using certain qualitative measures. You'll be hearing about them today. But what we also want to know is, are there physiological changes that happen as we walk about the museum? How do we do that? And these are projects that are running currently within VITALISE and in Greece, in Montreal, in Germany. What we are looking at is, will heart rate, for example, change? We know that heart rate changes. We know that that other physiological changes do happen when we are happy or when we are sad or when we are stressed. So all of these technologies can help us measure, quantify, and you'll be hearing about quantitative methods as well. They help us quantify experience, which is also measured through qualitative methods. And this is, again, the Museum of Fine Arts and the different experiments that are going on in there. Now, we may also just want to know, or begin to know, the experience of persons using technologies for communication. This is another project, the AI project that I showed you earlier. Here we seek to better understand the experience and attitudes and opinions of key stakeholders like persons with aphasia, their caregivers, speech-language pathologists, and with partners of the IBM Human-Centric Innovation. Now, our rehabilitation centers are full of all kinds of assistive technologies that people don't use. They are given, the government pays for them, they are given, but people don't use them. Nevertheless, they have difficulty communicating. So the question becomes, what can we do about that? They want to communicate. Stroke and language limitations that follow stroke are quite important, and they change completely a person's life. So our question is, okay, if we want to change, are we going to create new assistive technologies that they probably won't use again? Or can we learn from their experience in order to do something slightly better? So this is precisely a project where we used qualitative methods, focus groups, discussion groups. You'll be hearing about them later on today. But before we even did that, we wanted to know what's out there. Because no matter which project we tackle, we certainly want to know what has been done already. And that brings us to searching background information. So we usually don't start a project from zero without having looked around to see what's already known on our topic. And then the question is, how does one find out? So one thing is for sure, that with limited person power, limited funding sometimes, there's nothing worse than reinventing the wheel. So in designing our research question and then moving into methods, we first want to identify gaps in knowledge, to see what information, knowledge is out there that could support questions and ideas for innovation. And that brings me to searching the literature. This is one way of finding out what's out there. And those of you who may have followed lectures on literature reviews and knowledge synthesis, this might be already known to you. But one way we do go about this is and we have gone about this for years, are traditional reviews. We go into the web and into different databases, platforms, and search for articles that may have been written on our topic. So we have general literature reviews, and these are the standard literature reviews that have been around for years. Now, if we want to not only just see what's out there, but also compare and criticize potentially different articles that might be around on our topic, then we're moving into the domain of a critical review, where we pull out information that's out there and compare it and criticize it. And state-of-the-art review is even a further step where we try to find this whatever has been potentially published in our domain. Now, there's no doubt that one could spend 2-3 lectures talking about literature reviews, and now I'm just moving through them very quickly, and I'll ask you to stop or either pull your questions during the Q&A period, or you can write me later and I can give you more information. Now, as we move into more systematic types of reviews, we move into the domain of scoping and systematic reviews. And I went over the rapid reviews that are actually quick reviews that are, let's say I'm about to start working on a specific technology that's tackling communication, let's say. Now, I want to know very quickly, has anybody done anything in the last 5 years in the specific area that I'm about to work on? Well, that could be a quick, rapid review. That's why it's called a rapid review. It's rigorous, but it's rapid. And I want quick information and a quick and prompt information. The two types of reviews that are widely used, scoping and systematic reviews. A scoping review looks to find out what has been done in a topic. For example, can exercise improve cognitive and language performance? If I'm interested in what's out there, then I will do a scoping review. Again, very quickly going through this. But let's say I'm looking at the effectiveness of a specific method, a specific technology. Then I'm moving into something more restricted, and then I'm moving into systematic reviews. On purpose here, I other than searching the literature, I said gathering information, because in some cases, all we really want is expert opinion, and we look for expert opinion. Or we're interested to see if different methodologies, what types of methodologies exist in a specific domain. That's your methodological review, or even a technology assessment review. I'm about to use a specific smartwatch. Well, I'm going to hone in and look specifically for information of that. That's your technology assessment review. Then again, I may just be interested in polling people, asking around, what's your opinion about X? And polling could actually, it could happen anywhere, at any point in time. Or I may be interested in observations. This is exactly what I showed you, the two pictures I showed you of the shopping mall, where essentially the persons who did this study, they just sat at the entrance of the mall and observed and counted How many people, how many mothers with strollers, how many people with disabilities, etc. So, or we could do other general observations that, and then the output of that can be used to design our research. So how you decide on the type of literature review depends on your research question and what you're trying to answer. It depends on the knowledge you're trying to acquire, the type of knowledge. It depends on the time frame. I can tell you now that systematic reviews take a very long time. Scoping reviews, a little less. Rapid reviews, much less time, and so on. It depends on budget. How much can you spend? And person power also. Then it also depends on who will use that review and on the type of data that you're looking for. So once you have your research question and you have established your research objectives, and once you've done a literature or a background review, and you have a sense of what the context looks like and what you're looking for, then you need to figure out how you're going to actually search and what kind of methods you're going to use. So at this point, I stop sharing and turn it over to Teemu.
Hello, can you see the slides? You can see, right?
Yes.
Yes.
Okay, great. Just a warning about
just 1 minute. Are there any questions? I don't see anything in the chat. But
me neither. There is no.
Okay, very good. Let's move on.
Yeah. Okay, I will continue. I have a terrible flu, so if I'm coughing while I'm presenting, sorry about that. So I'm talking about research planning and selecting research methods today. And for those who were in the webinar too, you might remember this kind of an three circles where we had development process, innovation process, and research process. And kind of, and I was explaining that the Living Lab innovation is kind of a clue between all of these. And today we are focusing more about this research process, which is basically about discovering new knowledge, insights, and understanding about the specific topics or area. So you might heard like, what is a research plan? What is a research protocol? What is a research design? A challenge in here is they are a bit kind of an overlapping concepts. But typically, it's the kind of the research plan is the most extensive of all of these. It's kind of a document type of it's a document kind of outlines the entire research projects and kind of provides high-level views on the research, including the objectives, questions, methodology, and anticipated outcomes. It's kind of the roadmap for the entire projects, and you could be using that as a tool to communicate your research to others, such as funders or your research team or on other stakeholders who are involved. And to me, the research protocol is kind of the more like a hands-on document which kind of specifies the more detailed procedures and methods that you are going to be following during your study. It's kind of the practical tool for you in a way. It's the guide that helps you to kind of do your daily research activities. And the research design is kind of a bit similar, but for me, it's I would say a little bit shorter version of the research protocol. It's also kind of a blueprint that outlines how the study is done. But this is really, if you look to the current literature, those are really kind of a bit confusing terms, but you will be you could be kind of exploring those by yourself and more about. So here's a typical research plan items. Your title, you have the introduction to the research problem or the questions, you have your research objectives and questions. Typically, you have to have some kind of a literature review done in order to show that you understand about the topic. you might already have the theoretical framework for your study, but depending on your, the research approach, that's not necessary, especially if you are, doing the study that is trying to build up the theories. And then you have this research design and methodology. And I've been kind of circulating this with this kind of a red box and kind of highlighting that to me, that section is the research design or research protocol kind of an area, what we are doing. Description of the research design, whether it's like experimental, survey, observational, you're talking about your sampling strategy and how many users or study subjects you will have, what kind of data collection methods you are going to be using, and about what kind of an analysis methods you are applying. And then you have also this ethical consideration. You try to highlight why this study is important, and you kind of showing that what kind of results this study might have. And then of course is typical, we are talking about the limitation of your study, and you will have a timeline what is doing, and in some cases you might even have a budget and references and some appendixes which provides more kind of an additional information. But on the other hand, the research design could be shown also relatively in short formats. This is one of our studies that we have been working on. It's about the developing a taxonomy for the digital devices that living labs are using in health and well-being context. And in here, what we did, we had a pre-study, which was the kind of we were sending surveys to the 10 living labs, and then it was followed by the interviews for those living lab personnel. And then we kind of decided to a Delphi study, and it was consensus seeking Delphi study, which basically means that we were trying to create a taxonomy in a way that all the participants would be agreeing on the definition and the structure of the taxonomy. Then we had in the phase 3, we had like 2 rounds of the Delphi panels. And then because we had some issues, because people were giving us a contradictory comments about some of the definition and some of the placements of the items within the taxonomy. So we decided to have a qualitative feedback workshops in order to clarify these things. And at the final stage, we had like a final review, making sure that those changes that they made in the workshops were actually valid. And then we had the results of that. So basically you could be showing the kind of, let's say, very core of your study also in this kind of a very illustrative manner. And the other thing is that especially if you're doing health and well-being studies, there's often we are talking about the interventions. And there is this, I think, the really good kind of a template for describing the interventions. Here's a structure, and there on the bottom of the page, you can see the link or the reference for this actual document. And I really highly recommend for you to kind of look this and use. It's kind of this describing that, okay, what is the interventions? Why are you doing that? What kind of materials you are using or is needed when you are doing this intervention? What kind of procedures you will have? Who is the actual person who is involved in this intervention? Do you need, for example, the doctor to do that, or do you have some kind of assistant people and so forth? And what kind of is it a face-to-face encounter, or are you using the online devices or telephone or whatever, where you are doing this? Maybe you do that in the hospital or people's home or some kind of public places. When you are going to do this and how much? Are you doing this only once, or do you have a repeating kind of interventions? Are you going to be tailoring that for the different participants, or is it going to be exactly the same for everybody? And in a way, this 10 and 11 and 12 is the kind of after you have done the study, as did you do any modifications for your interventions? Was the interventions done as planned? And were you pleased about that, how the things were done? But in a way that if you read this document, there's a pretty good kind of self-explanatory descriptions for each of these stages, and this will be really helping you to kind of thinking about all the aspects that are kind of needed to execute your intervention. And this slide was also presenting in the second webinar, which kind of shows the common research process. And Eva was kind of talking about the points 1, 2, and 3. And then I'm now going to continue about this number 4 section about defining the research design and determining the sample in a way. And the rest of that stuff, it's going to be discussed later on in the webinars. In webinar 8 is discussing about these ethical issues and participant recruitment. You have been already that has already been done previously. So you basically have like 2 different types of research approaches. You can do a qualitative or quantitative research. And qualitative research is typically done kind of in seeking or understanding the underlying reasons or the motivations and the whole phenomenon that you are investigating. It's typically that it's non-numerical data where you have like a interview data or images or narratives or some that kind of things. You can do also typically like observations or open-ended surveys. And relatively, you have relatively small samples. And if you look for the scientific literature at how many interviews you must done in order to kind of gain the good enough results, and depending on the sources, but typically it's like already from 6 to 12 is, or 6 to 15 is about the amount of the interviews that you typically will be already good enough for you. And it's kind of a data analysis, typically inductive, involved in kind of finding the themes and the patterns from your data. Whereas the quantitative research is more about the kind of testing hypotheses, making prediction, try to generalize your findings to the larger population. And it's using the numerical data variables, which you can be analyzing statistically, like you will use in surveys or experiments or that kind of an approaches. And typically you will have a much larger sample comparing to the qualitative research. Then the other approach that how we can see the different research approaches is the exploratory and confirmatory research. And the exploratory research, it's about exploring the problem or the question. And this is typically, if you think about the living lab process, we are doing this typically in the early phases of the living lab innovation process. We try to kind of generate ideas or generate hypotheses regarding to this phenomenon, what we are exploring. And we use interview focus groups, case studies, observations, and often like this open-ended, semi or unstructured questionnaires in order to remain flexible when we are doing the data collection or the analysis. And similarly in the qualitative research, the sample size are typically small. And it's all about that kind of an understanding or describing about the phenomenon, what we are doing. And this is typically the duration of the exploratory research is relatively short, because if you do, for example, the interviews, you can be conducting, let's say, 10 interviews quite rapidly. And then we have the confirmatory research. It's about the testing and confirming the either existing theories or hypotheses. And in the later stages of the living lab process, what we are doing, for example, we are testing that is this solution better than the existing solution, or is this an effective, or will this help people? Will people come healthier if they are using this device or something like that? And it's always this kind of hypothesis driven, and you must kind of define the hypothesis before your data collections. And you are using for the data collection is kind of experiment surveys, maybe structured observation or something like that. And you try to control the situation in order to minimize the bias. And in order to do your analysis, you have to be using these statistical methods to kind of determine that if the findings what you are finding are significant statistically, because otherwise it doesn't matter. Then the other thing that what we can be looking at the research approach is, so we have this primary and secondary research. The primary research is all about that you are collecting the data for the specific purpose, like you are doing the interviews or you are collecting the surveys. And of course, this is more time consuming and research intensive because you have to do that. You have to define what you are collecting, and you have to do the collection, and you have to analyze the data. And you typically have kind of in this, you are tailoring to the specific research objectives. And of course, the good thing about this is that you will have a very fresh data. It's up to date. And the secondary research is also very important for the living lab research, because you could be using like existing data collected by the others for the different purposes. And one of the aims also in this VITALISE project is that each of our living labs are opening the data what they've been collecting as a part of this VITALISE project. So you could be using also those kind of data for your own studies. And it's basically like analyzing the existing data. It can be like you could be collecting the reports or literature or databases. And of course, because you don't have to in a similar manner collect the data because it's already existing, then it's kind of should be less time consuming and less efforts for you. But of course, because you are limited what kind of data is available, and not necessarily that data is kind of giving you the right answers for your specific problem, but it could be giving you kind of the overall understanding about the phenomenon that you are investigating. So once we get to the analysis of your data, we can take two approaches, inductive or deductive analysis. And inductive analysis always starts with a specific observation. It's kind of a bottom-up approach where you kind of try to develop theories or hypotheses based on what you have been observing. And it's kind of an open-ended and very exploratory. And of course, the idea is to kind of from your data to find new insights and something maybe unexpected findings that we didn't understand before, but they're collecting all of this data and going through it, so you discover something what is important, for example, for the users. And it's also kind of aiming for the very flexible setup in a way that you could be kind of adjusting your research setting in order to follow whatever is kind of interesting or what kind of findings you discover from your data. On the other hand, the deductive analysis is starting from the general hypothesis or theories, and you kind of trying to test if this hypothesis is valid. For example, very similar that I was describing previously already, that if you are using this device or if you are doing this, will that, let's say, make you healthier or happier or whatever is your research objectives. And these are clearly more structured and focused, and commonly are using quantitative research approaches. And of course, in this kind of settings, the predefined framework or set of assumptions are required before you are starting to do this kind of study. So that's the kind of the main difference in here. But when we are remembering the definition of living labs, and one of the key points in the living labs is that it's a multi-methods approach. So what does it mean that we are using when we are using multiple research methods? The question is also for you in a way that what kind of methods you are mastering or you are willing to learn. Of course, you cannot be using methods that you are not able to apply in practice. And that's why it's also, whenever you are doing this kind of a method selection, you have to be carefully thinking about that, that am I able to do this? Am I able to use this method or not? Or in a way, but I would be saying that most of the methods are really kind of unlearnable. So you just have to devote a bit more time to kind of understand that how these methods are working. And also in a way that you must be carefully thinking about that. It's not like if you know one method, it's suitable for everything. Because we have the saying that if you have a hammer, all the problems looks like a nail, but that's definitely is not not the correct thing. And you can use different methods to answer different research questions, but you can also use different methods in sequence, or you can do more than one method at the same times. And also this kind of something to think about for you is that do you have the resources to use the methods? Like, for example, do you have that particular statistical software? Do you have this audiovisual or the sensor equipments? And one thing that we've been encountering quite a lot is that because we are part of these international projects, and we do a lot of data collection in different countries. And I've been many cases in the projects where we have Spanish partners, and because in many cases we are doing the interviews or the focus groups in a local language, and I cannot be speaking any Spanish. So that's definitely a kind of a limitation that I'm only able to do the interviews in English or Finnish language. And also in a way that in this kind of a multicultural setting sometimes what we do is that we collect data in English. So, everybody can then be using that data. But then depending on your research setting is, of course, that the language might be an issue because not all the target groups are able to speak fluently English, and that might be giving a bias to your study because you have to be selecting the persons who speak English, and they are not necessarily always the persons that should be actually part of your study. And then the one important thing is also triangulation. We have different types of triangulation. We can use multiple data sources. Like we can, for example, we could have an interview data, we could have a survey data, we could have observational data, and so forth. And the other thing is also that in many cases, in the Living Lab studies, we actually have multiple researchers working on these projects. And because, for example, if you're doing observations and two persons are doing observation at the same time, it's very likely that they are kind of focusing on different things, and then you can be kind of filling the gaps which the other ones is not seeing, but the other one is seeing, and so forth. And methodological triangulation is about using of different research methods within your study, or the theoretical triangulation, using different theoretical frameworks to kind of interpret your data and they understand your research problem. And I think this is very important to highlight in here that many of the phenomena that we are researching in the Living Labs, they have already been researched quite a lot in a way. And that's why I really highly recommend that whenever you are doing a study on a certain topic, you really go to do your kind of literature reviews and look out at what kind of what do we know about that phenomenon already, and what kind of factors are influencing on the people's behavior and so forth. And there's a lot of these theories. And once you have those, you could also be using these kind of validated questionnaires for example, for the user experience or the well-being or something like that. And then data analysis triangulation is basically kind of the same as the methodological triangulation, but in this case we are just using a different analysis methods. And also time triangulation is one of the possibilities you can be doing, that you are kind of collecting the data at different time points, and you will get these kind of snapshots from each of the time points. And the more triangulation you will have, the more robust probably your results will be, because you could be looking at that from the many different angles. But of course, you have to be thinking carefully that how much resources you have and how much time you can be devoting on all of this, because each of the steps that you are doing is of course causing you a lot of work. And we can also follow this kind of the mixed method approach. So basically meaning that we are doing qualitative and quantitative research at the same time. And what we can do is this can be like a partial or fully mixed methods. Are we doing this in concurrent or sequential manner, or which of these methods we are putting more emphasis? Like, are we doing, the more in the qualitative approach and trying to understand that, and then just kind of, for example, verifying some facts that what we've been finding with the survey? Or are we doing kind of in the whole thing is about that, okay, we are trying to verify something, and maybe just adding more insight to our results by doing some additional interviews, try to explain that why our results are like that. But always thinking about that you can do those in sequence or in concurrent way, and thinking about that, the which of these methods will be more dominant. And as a general rule, I would be saying this kind of an qualitative approaches are typically more emphasized in the early phases of the living lab innovation process or the research process, and this kind of an quantitative confirmatory type of an research approaches are in the later stages, where we are trying to validate the impact or the outcomes of the studies. This slide was also presented in the webinar due, which was showing these different tier levels and what kind of activities we are doing in each of the stages. And as you see in this table, that some of these early phases we are typically doing in the laboratory settings, and with the laboratory I mean that it could be like a office room where we are running a workshop. It doesn't have to be like traditional scientific laboratory where you have these fancy devices, but it's more about just saying that it's not in a operational or relevant environment, which is the kind of a reflection or this simulation of the possible operational environment. So in here, when I was doing this slide set, I was also kind of thinking about that, okay, how do we put the different research methods for each of these stages? And it's actually a bit challenging in a way, because many of these approaches you could be filling in the many of these phases. Like, for example, interview. Basically, you could be doing, for example, interview in any of these stages. And so forth. But it's always the kind of the combination of what kind of questions you have in hand and what kind of the outcome you are trying to get out of your study. But that's why I just kind of collected the kind of a set of common methods in each of these, let's say, in main categories. And in here, if you think about the interview methods, so we can do structured interviews or semi-structured interviews or unstructured interviews or kind of a focused group type of works. And the challenge in the, let's say, in structured interviews, it's because you have the fixed questions and you have fixed order of questions and fixed number of questions, and you cannot do anything besides what has been defined. Whereas in semi-structured interview, you will have a group of fixed questions, but depending on what people are answering, you can be kind of changing the order of the questions, in order to follow what kind of an interesting topics the actual interview is saying to you. And you can also ask additional questions. And I would say that in living lab research, probably the semi-structured interviews is the most common way of doing. And then there are the different, let's say, subcategories of the interviews, like empathy interviews, where you're actually really trying to deeply understand the experiences and the feelings of the other people, or you do kind of an in-depth interviews, where you are exploring a single topic in the very great details, or you are collecting narratives from the persons in order to them to share their personal stories and experiences. You can do ethnographic interviews. And of course, the expert interviews are very important because we are in many cases doing solutions which involve the experts. And we have these key informants, which could be like, let's say, policymakers or the whatever kind of an important persons you are, which are related to your study. And then, of course, you can do telephone interviews, video and online interviews. And I would be saying that because of the COVID, this kind of an online interview things has been a kind of a really nice bonus for the researchers, because now we can, they do in, especially if you're doing that in English, that you will have you can or you can transcript your interviews right away, and you get very fast results. You don't have to wait for the sending those to some company who is doing the transcripts for you. And of course, there are some limitations what these automated transcriptions are doing. But anyway, that's a whole lot of better situation comparing to, let's say, 10 years ago. And then if you think about the observation, which is also quite common in living lab research, that you can do it in the naturalistic or controlled observation, basically meaning that are you doing the observation in the environment where the people are, or it's kind of do you have some kind of a setup which you are actually controlling, and you put the people over there. And especially the commercial companies are using quite a lot of this kind of one-way mirror observation, where you have a focus groups in the room, and you are behind the one-way mirror, and you're observing that what the people are doing over there. And then, of course, you can have a structured or unstructured observation, and depending on that, do you follow some kind of a structure, or is it more kind of a flexible what you are doing? You can do it the observation continuously, or you're only focusing like anecdotal observation, where you are only kind of recording non-worthy events or behaviors which might be relevant for your research questions, or you focus on specific events of the interest, or you do this kind of time sampling by collecting snaps of your activities. Or you can, let's say you are in a larger group, but you are only focusing on the one individual within the larger group. And you can be a participating or non-participant observation. And the participant observation is where you're actively participating and engaging with the study subjects, or you become as part of the group. And in a way, in some cases, you can be aware that you are observing them. And each of these have some benefits and drawbacks. And depending on your settings, you could be kind of thinking about what would be the best for you. And this list is kind of just for you as, let's say, a checklist that, okay, I could be thinking about this kind of an approach, or that kind of an approach. And then, of course, the feasibility, which is typically in the proof of concept phase, where we are doing kind of the technical validation of the solution, or we can look at the financial feasibility. We could have like expert reviews, or this kind of a proof of value, trying to, validate that what kind of a value you have. We are doing risk analysis, and also especially in the health and well-being settings, this kind of a regulatory compliance check is very important. And especially if you have these technology companies who have not been working in the health and well-being environment, they typically don't understand this kind of regulatory aspects. And of course, the market research and market trends are very important to understand that, in what kind of settings your assumed solution is going to be. And then we have a lot of different types of testing, things like 5-second test, which you show something very briefly to the users in order to kind of assess their initial impressions, and then you ask a few questions from them. Or the qualitative testing or qualitative usability testing, when you have a very early phase solution, you just go to the shopping mall and you ask, the whoever comes over there and saying that, what do you think about this? You have heuristic evaluations where the experts are evaluating without direct real user interactions based on, these kind of yeah. And thinking aloud is one thing that where the users verbalize their thoughts and feelings during the interactions. And we could be doing task analytics, where we ask users to perform predefined tasks and try to understand how they interact with the specific tasks, or the usability testing or accessibility testing. In many cases, and for example, the stuff that Eva was showing, they were using eye tracking for that. Or if you are using, the online solutions, you use heat maps and the kind of analytics where you are collecting passive data from the users, or the tree testing when you are evaluating the findability of the information. And of course, this kind of prototyping thing is, I would say, the bread and butter for the living labs, and the pilot studies in the tier levels 7 and 8, where you're doing the small or large scale pilot tests in the real environments. Or you could be the A/B testing when you are comparing the different versions of your solution and try to think about that, which one is the better one. Or you are benchmarking testing. You have either kind of define a certain criteria where you are comparing, or you are comparing between the different versions, previous versions of the different versions. And you can be the non-moderated or moderated testing, and you can do also nowadays this kind of a remote testing is quite popular. And then we have impact analysis, the pre and post assessment, cost benefit analysis, social return on investments, randomized control trials, quasi-experiment designs, meta-analysis, longitudinal studies, scalability assessments. And this, for example, the scalability assessment, especially in the TRL8, is very important, because some solutions really might be working at the let's say in a small scale, but can you really scale it up in an effective manner? And that's really important in TRL8. Okay, that was pretty much the thing that I was thinking about telling you. And if there are any questions for me, so I'm happy to answer. Do we have any questions?
Can't see any at the moment.
Okay. Either I was very good or very bad. we find out
yes,
once we are in the in the rooms.
Yeah. Okay.
So
then
so I will
over,
put your slides. Just say that.
Yeah. Yeah. Thank you. And I'm very happy, Timo, that you talked so much about qualitative, quantitative, exploratory, and confirmatory research design, because then I don't have to do it myself. So I can talk a bit more about abstract things. Okay. So I have some preliminary remarks just to start my presentation. There are only three of them. These are just some thought-provoking minor experiments from my side, provocations, so to say. The first one is do we really know what is a method? Because I think if you look through the research papers concerning research in living labs, you very often come to this common Merriam-Webster definition, which defines method as a procedure or process for attaining an object or accomplishing a certain task or achieving something. So it's always a goal-driven notion or concept, but I don't think that it is necessarily so, because if you look at its Greek origins, then you see that it is composed of meta and hodos. So method is a meta hodos, which means if you translate it, it means something like in the midst of a journey. So by means of a journey that something might appear, I think. So it is more about the journey than getting actually somewhere. So it's not oriented towards a goal, but towards that we make something appear through a certain kind of exposition in the world. And so we create conditions where maybe something, we hope that something new might appear. I think it's very important. And also, I very often see that method and methodology is not very well distinguished from each and other. A methodology is different from a method. It's I think we can say that a methodology is a structured, philosophically and theoretically informed thinking about how do we get to know anything in the world, and how do we choose then our methods that we want to use for getting knowledge, so to say. So methodology is an informed thinking where you think also about ontological questions, like what is being, and also epistemological questions. How do we know certain things? It is very important, because once you have a certain thought or thinking in regards of these questions, then if you have a methodology, so to say, it becomes much more easier to decide on the methods that fits a certain kind of methodology. And also the laboratory, it is, again, it is an important concept, especially that we are talking about living laboratories. And you know, if you look at the old French laboratoire, so it has two origins. So one of it is the workshop of the chemists, and the other one is the workshop of the artists. And you know, in both of these laboratories, they were basically set up as a testing environment in order to catch something. So it was like to trap something that emerges. So it was more about experimentation, and not about achieving certain goals, but really seeing what can we make appear what we don't really know. So from this perspective, I'm just proposing that maybe we can shift our thinking a little bit from seeing what we think to starting to think what we actually see. So I think it's a different relation to the world. All right, can we go to the next slide, please? So as you know, maybe you are already familiar with it from the previous presentations. There are 5 basic principles of the Living Lab methodology. It's continuity, openness, realism, empowerment of users, spontaneity, and Living Labs, I think they try to create a synthesis between these principles to really create a real-life test and experimentation environment with, of course, users who are aware that they are involved in the innovation process. And in this regard, you know, the Living Lab, you can say it's not only a mode of operation, but also a particular kind of research methodology. So Living Lab is not only a technological, operational framework, but the Living Lab philosophy also comes with a research methodology, I think, which aims at co-creating innovation through the involvement of users in real-life testing. And sometimes I'm wondering, especially if I read these research papers, why many definitions of Living Labs have focused only on the organizational characteristics, you know, or the managing entity and the environmental characterization, but not really about methodological peculiarities of the Living Labs. Can you put on the next slide? And yeah, So as Timo already pointed out, it's a multi-method environment, question mark for me. It's a question mark, of course. And there are many classifications of methods. Timo already presented you a few ones. I just present only one of these classifications. It is from a recent text by Judy Hong Huang and Elisa Thomas. I can share it with you in the chat box. I think it's good if you look into that. They created these different categories based on the review of 42 empirical papers. And they categorized research methods according to these 8 frames or dimensions. And they say that there's this structured interaction, which refers to the most formal and organized formats, such as observations, surveys, and user testing. And then there are these flexible interactions, which have more freedom in arrangement and flexibility for interactions between organizers and participants. And among these flexible methods, you find interviews, co-creation workshops, user meetings. These are the most popular. Then the extended network, it highlights the importance of reaching out to a broad network through building or engaging active user communities, attracting public attention and encouraging participation from users and related personnel. Special actors, so having special actors, it echoes user theory by appointing active players as early movers and contact points among users. Learning, engaging investigates how to connect users in the process, mentioning methods like innovation camp, tailoring, team building, user training, fun tasks that motivate users. Design approaches is also a dimension. It takes more systematic design perspectives through participatory design, bottom-up approaches, and design thinking. Techniques involve using a few specific tasks or procedures that have certain formats and have been practiced in other fields, like storytelling, hackathons, roundtables, world cafes. And finally, the operational guidelines, it's just a sum of the general rules of the specific methods. So it is immensely overwhelming, I think. Can you put on the next slide, please? Because this is what I want to say. This is just a snapshot of how they made these classifications. I sent you the link. I think it is good if you look at it. At least it is a classification, and you can see the methods, you can see the thematic domain, and then you see some further information about them. So it is not that bad if you have such a developed list of methods. Let's go to the next slide. But I think what I wanted to highlight here is actually that it is really a lot. It is really a lot, and this I think maybe this multi-method thinking. I'm not against the multi-method thinking, but maybe it makes a bit of a confusion, And scholars argue that, of course, they say that there is a multiplicity of methods and tools. What we lack is that their usage fails to demonstrate the unique characteristics of living labs, especially considering user involvement. And studies, also have shown that this heterogeneity and multiplicity of methods used has made it a bit hard to compare and adopt on a broader scale. So, for instance, to compare studies within living labs, and also the diversity of these methods that reside in living labs, their activities, channels of communication, and reporting have a little bit hindered the knowledge transfer as well. So, concerning this immense multiplicity of methods, I think we have to think about it, and maybe there is a task to change our mindset a bit. And what I want to suggest here is that maybe it's not the good question to ask what method is good for me if I want to know this and that, if I want to achieve this and that. But I think that the good question is asking yourself, okay, what do I think about the existing world, in the sense of how can I get knowledge about this word. So it's an ontological, as I said, ontological, epistemological, and finally, it's a methodological question. So, and once you have the methodological, your own methodological framework for thinking, then it will be completely evident what kind of methods it allows you for. So it is not the other way around. This is what I want to know. Let's see what method can I use, like if you were in a shop. But first you think through these very basic questions. What do I think about reality? And what do I think about subjects? So what do I think about the very thing that people tell me information? What can I do with this information? Okay, next slide, please. And this is just a classic example of the first mode of thinking when you want to know something and you look for a method. This is a case of from 2007 from a living lab called Record Living Lab, and they were creating a music streaming service. And so they wanted in the ideation phase, in the idea phase, they wanted to have user feedback. And so they created surveys and interviews. And here you can see some examples for quantitative items in their surveys and qualitative items as well. And then you can also see what kind of feedbacks they got. Some of them contained no detail, and some were highly detailed, you know. And this finally in their report, they said that this level of detail in the qualitative domain provided very little feedback. It was almost completely not useful for designing and for going further from the idea phase. Can you go on the next slide, please? And we can read in the report, the previous one, thank you, that a relatively small proportion of the feedback items were perceived by the designers as being highly relevant, possibly being able to pursue interesting leads in the feedback through user-designer dialogue would serve to increase the importance of the qualitative feedback. This seems to indicate that participants who experience the application area more relevant to their interests will be motivated to provide richer feedback. So basically, what we can sense here is that some kind of a participative character was missing. Of course, the research was user-centered, but there was a lack in terms of involvement, engagement, and participation. And they also write at the end of the report that within the Record Online Living Lab, they will work to improve the participants' engagement by investigating how the presentation of ideas and designs, as well the way questions are asked, can affect the engagement of participants. Yeah, next slide, please. So again, I think the right mode of asking your question about research is not what you want to know and how to connect a method to it, but what is your methodology and then what it allows you for. And if you want to have, and I think living labs should have some kind of a participatory design in research, which is engaged and user-centered, then I think it already outlines a little bit our possibilities in a living lab setting, not in terms of methods, but in terms of methodology. And if we think about the living labs in terms of methodology, and here is another article by Claudio Dell'Era and Paolo Landoni, methodology between user-centered design and participatory design is a title, and they argue that if we make a map along the dimensions of design-led research, or design-led or research-led dimensions and expert mindset versus participatory mindset, then the living lab is on the bottom right corner in the participatory design research-led dimension, which is not to argue that none of the other methods from the other fields can be used, but it is to argue that from a methodological perspective, a living lab is somewhere in that domain. And the participatory design is an approach to design that attempts to actively involve all stakeholders in the design process to help ensure that the product design meets their needs and is usable. And in participatory design, participants are invited to cooperate with researchers and developers during an innovation process. Potentially, they participate during several stages of this process. They participate during the initial exploration and problem definition, both to help define the problem and to focus ideas for solution. And they participate during development to help evaluate proposed solutions. So users become aware of their involvement in the co-creation when they are invited to participate and does not specify the nature. So we do not specify the nature and the characteristics of the users. The next slide, please. And one of the methods, and maybe we could say it's even something that is almost a methodology that encompasses participation and user-centeredness in a research-led design, is action research, which is used more and more frequently in living lab settings. And action research is a term, it's a notion coined by Kurt Lewin, and he defined it as an action which it's a comparative research on the conditions and effects of various forms of social action and research leading to social action. So it is also research that leads to social action, not only observes it. And it uses a spiral of steps, each of which is composed of a circle of planning, action, and fact-finding and implementing the knowledge that was produced, and it goes all the way around again and again. And action research starts from always from a practical problem within a certain group of people, and the aim is to find a solution for this practical problem, but also to develop theoretical knowledge for the research community. And as you can read on the slide, action research is not research on people or even for people, but with people. And I'm wondering if you also find all this that I already read to you, something that is very similar to the living lab approach. I think it really encompasses what the philosophy of living labs are. So we can, I think, argue that the characteristics of action research are quite well aligned with the methodology philosophy of living labs. Next slide, please. And this is just a very, very small case. iMind's living lab, they used action research, but the interesting fact is not that they used action research, but that they used it in order to evaluate their own living lab for self-evaluation, which is a very important thing to do, but we not very often think about it when we think about living lab research, that we can research also ourselves. And they involved all the panel members and users in this action research, where they wanted to explore the daily life of the living lab and its operations. And from an action research point of view, they had three steps that created a circle, which then turned into a spiral. The first step was to gain knowledge about their current situation, for which they used, like many kind of methods. They used focus groups, and they also use surveys. So you can see that of course, when you have a methodological framework, you're free to put any kind of methods in it that really fits your aims. The second phase was to plan, carry out, and analyze the ongoing actions in the situation by means of the panel members and users. They became researchers themselves. So panel members and users turned into living lab researchers who did research on the living lab. So it was not only them who filled out surveys and answered interviews, but they also started to make interviews and ask questions and create their own research. And in the third phase, they applied the knowledge generated to a project and also reflected on the outcome. So they again derived knowledge from each case. So they also first, on the one hand, they with the generated knowledge that came from the second phase, they put it into project development, but also from that they created new knowledge. And by inviting panel members and users to these co-creation sessions, they became part of the reflection process on the operations. So the panel members and users became part of reflecting on the whole process of the research. So, you know, because in the classic mode, the person or the people who on whom you do the research, they are not part of the reflection when you analyze the data and deliver your findings, but these people were also part of that phase as well. And lastly, next slide, please. Lastly, just free, not yet, just free take-home messages. So the first one is that if you think about qualitative research, I just wanted to tell you that we are miles ahead in qualitative research from the basic forms and methods that are very popular still these days and mainstream, from interviews and focus groups and workshops and so on. There are many papers that are dealing with the fact that we are almost in a post-qualitative era, and I really recommend you to make a Google search on that. What is post-qualitative era and what kind of research methods are available even online? I think you will be fascinated by this. And the second one is that, as I already tried to make you feel somehow this way, so that we should have philosophy as a starting point and not the problem we want to solve. So I really urge you to start with the question, what is reality, and what is the subject, and what is that we can know about the existing world. And finally, that's only a proposal, so we should really strive to make the living labs embody what they stand for also in their research practice and methodologies, and also in the way they are organized. It is not necessary to have all the living labs function in hierarchic structures. You can find more egalitarian and communal forms of working together with people. So this is a task for us, even a methodological task for us, how to embody what we stand for in the living labs. Thank you. And that was the last slide. And now we can go to the questions and then to the breakout rooms.
Okay, it seems also that there are no questions in the chat. Okay, we have the breakout room task. And if everything goes well, we will have 3 groups, and in each of the groups there will be a host, me in one, Eva in one, and Thomas in one. And the idea is that we are not participating on discussion as such, because this is task for you, but it's kind of you as a group select one living lab study, either existing one or you can imagine one, and then kind of collectively define the research questions for your study, and then shortly describe the overall design of your study, and select the potential methods for to solve your research questions, and then select the one person who will be presenting the results to the other groups. Any questions on this task? Maybe you take the...
I'm just looking at, if I may interject, I'm looking at the numbers and I'm thinking that maybe with 2 groups would be enough, because
Okay, they were dropping because for a minute ago there was 20 still.
that's right, but
yeah, okay,
people
we
may
can...
not be
Yeah, we can put two. Yes.
breakout.
Yeah, you're
So,
right. I didn't notice that, but yeah.
yeah.
Workshop is
So
not
we may
interesting.
no,
Yeah,
that's okay.
let's put two groups.
Whoever is there is good enough. So 11, that would give us minus us 3 and minus
Yeah.
a null. So that's 7. I wonder if we just want to keep it as one group because really there are
Okay, yes, because there are
seven.
many of us as well. Okay, let's do that. So, but now we gave the room to our our participants, and does
Mhm.
anybody have a good idea about the study? You can now promote your own study and get some additional insights for your study from the others. Anybody, please feel free to suggest a study.
Or do we maybe the three of us remove ourselves? We kind of shut down and then let people discuss by themselves.
Yes,
What do
that
you
would
think?
be. Yeah, that would be the idea.
Okay, so we'll just mute ourselves and shut down our cameras, and then why don't you open your cameras so you can see each other and just come up with a study or two and any question, and we will come back to you in about 5-10 minutes. Does that, Tamas, you're okay with that?
Yeah, of course. I'm just wondering whether it is clear for the participants what the task is.
Mm.
Not entirely, someone says. So yeah, maybe
Uh-huh.
we should specify a little bit. Someone has one. Okay.
Oh,
If you have one, I think
well,
yeah, you are absolutely welcome.
why don't we go ahead? Do you want to go ahead, or how do you want to do this?
Uh,
So let me just go back to give a little bit of additional explanation. So we spoke, you heard a whole bunch of things today. And I'm not surprised that people don't have questions because it's just too much to integrate. But the idea here is if you have an idea for a potential study within the Living Lab group, within the Living Lab context, then um, do you, can you come up with methods that could be used to address your question, Thomas?
yeah, so I just wanted to say that it can be also an existing study, or it's something that you are
Yeah.
fantasizing about.
Yeah, but on the chat, maybe
Yeah,
Naila,
please read
who
it.
was putting out the chat, so maybe you explain that what it's all about.
Sure. Should I explain now?
Yeah,
Mhm.
sure.
Oh, the group? Oh. Yeah, so I'm not sure if it might be too abstract for this exercise, but my current project, I'm interested in what experiences of Parkinson's disease are very difficult to convey to someone who doesn't have Parkinson's disease themselves and how that creates communication barriers. So I'm working currently on a participatory research study in which we're identifying like what aspects of Parkinson's are very difficult for someone to relate to or to convey, and how we can use other more multisensory formats to convey them. So using like immersive technologies, using also artistic media, how could we have someone understand a bit more the felt experience or the embodied experience of Parkinson's disease?
So
For the objectives of knowledge transfer and empathy primarily.
Is your objective a bit like because there are these, for example, these fat shoots that if you know that the fat shoot, you know, that you get the certain shoot, there is a really heavy and really really big, and you put that onto you in
Yeah.
order to experience what is to be really obvious. And
Yes.
I've been testing that kind of a shoot once, and it's really like, you know, that your movement becomes totally nightmare in a, are you trying to create kind of the fat shoot for Parkinson's?
Exactly. Yeah, that's a very good comparison. Yeah, or certain virtual reality experiences to simulate what it might be like to have sensory overload in autism. That's another example. There actually already exists an armband that replicates the tremor of Parkinson's, but I'm looking for something a bit more comprehensive. But that would be also an example related to Parkinson's.
Is this ongoing now, or have you started anything at all?
Yeah, so I started a pilot study that I'm currently working on. So where we interviewed people with Parkinson's, a very small group of people with Parkinson's, informal caregivers and professional care providers around what experiences are difficult to convey, which is, it was a bit of a challenge to interview about what escapes verbal communication, what escapes words. But we identified some aspects that people with Parkinson's would like to better communicate and that care providers or caregivers have a hard time relating to. And then we put out a call to artists working with new media to propose a prototype that would address one of those aspects. And now we've been going back to our participants and asking them to vote or to give input on the different prototype proposals we received, and we're pursuing one in particular. And then that's a pilot study, but that's leading into a bigger study, which would start with more exploratory workshops and then move into really co-creation of using different technologies at our disposal to try to communicate an aspect of Parkinson's disease.
The ultimate goal, well, I presume there's sensitization in this, and then experiential
learning,
feeling, learning. Yeah. These two. Wow. This is very interesting. Where is this happening, out of curiosity?
At McGill. I'm based in Montreal at McGill University with Stephanie Blaine-Morais.
Oh, yes. Right. Yes. Whom I know. Yes.
So that's the kind of thing. So you already know that what are the, if you're, I'm not expert in this field, so I'm just punching some ideas. That's if I compare that to this fat shoot in a way. So in a way that have you already collected all the, let's say, factors or features that are included to be immersively experienced to become in that situation, Parkinson's situation? Do you know all of those already?
No. My sample size was very small for this little pilot study. So that and Parkinson's is such a heterogeneous condition and such a comprehensive condition that affects so many different parts of the body and the mind, which is part of the body. I think we have to take it piece by piece in some ways. But one place that I'm very interested in starting is figurative language, analogies, metaphors, expressions that people use to describe their experience. And so part of what I would like to do sort of as an exploratory study and as a, I guess, crowdsourcing would be to work with local advocacy groups or even across Canada and ask people to submit expressions of their experience with Parkinson's disease. So whether it be globally, some metaphors they've used to try to convey their experience, or metaphors of specific symptoms or analogies of specific symptoms related to Parkinson's. So I want to, in a way, start with the words to move beyond the words to then put it into a more immersive experience. Yeah.
Yeah. So if we think about these TRL levels in a way that, if I understand correctly, your situation is you're basically kind of in the TRL1 in a way, to understanding the things. And once you know these particular features that would be represent these conditions, then it's all the kind of or the concept creation, that trying to create that what kind of a concept would be delivering certain kind of an the experiences. And then of course it's maybe like you say that maybe some of those experiences are so difficult to replicate or simulate that they are actually impossible to do. Basically it's like a proof of concepting, and then probably you have to do it in a way that once you know the features and you try to come up with these different concepts, and then you have to be in the TRL3 kind of an evaluated what is actually possible. And once you know those that are, let's say, easiest to done and delivers the best possible outcomes, then you will be doing prototypes for those ones. That would be the things that I would be probably kind of following. But yeah.
Yeah, we're moving ahead with one prototype, and so I was very interested in the different testing methods, like which would be most appropriate for the I won't get into it now, but the specific prototype we're moving ahead with. But I also see that someone else had put their project in the chat. I don't want to eat up all the time.
I was just actually checking that. But Naila, let's talk again, especially considering that we're in the same space, more or less. But there is some work, just as a closing remark, there is some work that has been done on persons with aphasia expressing their feelings and their isolation, etc. And we can, email me and we'll chat.
That sounds
This
great.
is really, really interesting. I'm glad you're here.
Thank you.
Thank you.
Okay, maybe Ibrahim could be explaining his situation.
Yes, sure. So, just a bit of background to what I'm doing. I think I'm using a user-centered design approach. So we started with a scoping review to specify the context of use. So we did a scoping review to see what mobile applications with the game-like features, with the gamification features are there for the children with disabilities. So we identified the most common gamification features. And then to specify requirements, the second stage of the user-centered design, we did 21 interviews with the youth with disabilities, the parents, the caregivers, clinicians, to see what kind of game-like strategies they want to see in the leisure activity mobile app. And in a bracket, so we are using a mobile app called Jouet. So it's a free mobile and web-based app. It's developed by Dr. Kyoko Chicago, my supervisor at McGill. And we are trying to develop a new version of the app with the game-like features. So we did 21 interviews so far with the different participants. And we are analyzing that, what kind of gamification features they want to see in the app. And we are analyzing that and using the qualitative results to develop the new version, a gamified version of the Jouet app. So we are in the parallel, we are working with our mobile developers and the mobile health experts using the qualitative results and to select the gamification features and implement in the Jouet app. And then in the next phase, as I put in the chat, we want to do a participator design. I don't know that the wording is correct or not, sorry, but it's using embedded mixed methods, both qualitative and quantitative. We aim to do 2 or 3 focus group. We are not sure that we want to separate each stakeholder. We are not sure that we want to separate clinician, parents, or youth in the different focus groups. But the idea is that we would show them a sketch of the new version of the app is like a mock-up or a sketch, and then they would share the thoughts about the new version. And also at the end, we would send them a modified version of the technology acceptance model to see and assess their perceived usefulness and their perceived intention to use of the new version of the app. So this is my PhD thesis. I don't know how far I can go, but this is the idea. And at the end, we want to do and test the experimental study. So the trajectory of the project is like that. So I'm completely open to get some feedback.
So basically, you know already now the possible gamification features that they were preferring, right?
We are analyzing, so because the context of the Jouer app is the diverse disabilities, and also we have different type of users. We have clinician and parents, so it's difficult to implement all of the features, but we are going with the most wanted feature. For example, the goal setting was the most common, the one feature that all participants wanted to see. They want to set a goal for the number of the leisure activities they want to go in each month, or about the type of leisure activities. So that features we want to implement for sure. But for example, like a points and the rewards, it's like we receive some mixed responses about some pointing and rewarding. So we are not sure about that, but we are working. It's in process.
Yeah. So are you kind of because you are building these prototypes, and then you try to do multiple prototypes with the different features, or it's like, are you running it the one with the all of things? Because you could be doing A/Bs and the combinations and so forth. This kind of methods, just to try to understand that what you are kind of doing. And also, like, it's typically what we do in here is, like you said, this kind of mock-ups that they will have kind of a user interface with the paper or photoshopped version or something like that to simulate the user experience in a way, and those are typically quite useful in that sense, that they will be actually seeing that. And what you can do is just like this kind of a Wizard of Oz type of an approaches, where you have the, let's say, the facade is exactly the like you have, but in the background you are doing the work in a manual manner. Like, give an example that you could have a new model for the shirt cleaning. Like, you say that you have a fanciest technology behind that. You bring the shirt and you get right away and clean shirt once you can, and there's a fancy process behind. So you can be executing that just buying a lot of new shirts in a way, and that they have that process in a way. So that might be also one thing that you could be thinking about. I'm not sure about what your solution is, but you might be also do that in a way to give the more realistic user experience for the users, if you can mimic or simulate the things without doing the actual applications. If there's the quite laborious work for you, but don't know that how much work you will have to do the application.
Exactly. So we wanted to have a UX designer in our team to create that sketch or mockup, and then in the participator design we would receive feedback that what features work or what doesn't work, and then we would refine that version and then create the new version at the end and release it. And
yeah,
that's the idea.
And also, if you think about then the later stages of your process, like the impact analysis, in a way that if they are, let's say, this cold orientation or whatever, you can anyway probably do the call orientation without any application to see that if the call orientation is actually, the providing the assumed impact that they will be doing that. You don't really need an application for that, because you could be doing that as well. Because of course, the most important thing is the impact of what you are trying to achieve, and the technology and the software or the application is just a tool to achieve that. And that's also good to remember in a way, that can you do that? Can you somehow verify the impact also without the device?
Perfect. Thank you so much.
Very, very, very interesting. Any other ideas? I'm mindful of time, and we kind of have 6 minutes left. Any ideas? Do you want to comment on ideas that have already been expressed? No? Tamas, any word from you? No. Maybe, oh yeah, go ahead, Diego. Yes.
Sorry, good afternoon for you. I have a question. Well, in my Latin American context, because I live in Brazil, but I work in a living lab here in this context. Maybe these methods that Thomas talked about the
yeah.
post qualitative method, participatory action research could be a nice method for implementing in Latin America.
Can you speak a little more about this and why you see that?
I try to propose a research here in Latin America with the car accidents or car crashes here, because we spend $1 billion in car accidents. I need to create a tiny tool, a process in living labs for mitigate or create practices to create practices to mitigate, create practices to teach the person for promoting and preventing the car accidents, maybe?
Yeah. This is very interesting and very, very much needed. I hear you. I come from a country also where there are lots of car accidents, and but it's also a very multifaceted project. What have you done anything up to now, or this is a brand new thought that you would like to explore?
Yeah. I don't know, this the European context is very similar to the Latin American context because have a lot of struggles, lots of problems. But I don't know the living lab methodology is could apply. I suppose yes, because I work in a Brazilian living lab too. It exists. Obviously, the focus is bottom up. The approaches are bottom up. But I have a question is about, is it exactly supplier or needs a robust processes inside the living lab to mitigate this impact? Because I think I have the relation with the governance in Brazil and Colombia, Mexico, maybe.
Yeah. So I have one idea for you in a way that because whatever solutions you come up, you could be, for example, implementing that in the certain junction or certain part of the city, you know, the whatever they are, you know, the like different lights of lights or whatever solutions you come up, you could be experimenting them in real life in those different settings and to see, you know, before you go there, you are evaluating the, you know, the amount of the accidents are normally happening. Then you implement your solution over there, and you see that will it have any impact on that one, because the problem you are talking about is also kind of a very cultural oriented in a way. I come from a Nordic country, Finland, and our traffic is much more law obeying comparing, let's say, Southern Europe or maybe India on these countries. So we are living in total different, but that because of our culture in a way that Finnish people are really law obeying, but still we have accidents really. But they are trying to make, let's say, roundabouts in order to, you know, limit the speed of the cars to make sure that, you know, if there's an accident, it's not a fatal accident because the speed is less. So I just thinking about that. You should probably try to seek out the solutions for the certain kind of setups like junctions or the highways or whatever there are, and then kind of implement them in practice in Brazil in different settings and evaluate that will they have any impact on the on those ones. Because let's say this kind of an cultural education where you are transforming your drivers to be more, let's say, conscious about the things, that's a very long process. So it's maybe it's easier to do this kind of an experiments from the living lab point of view, at least.
This needs to be multi-pronged approach. So you have government giving incentives, or the insurance companies giving incentives. If you have no accident, your insurance is going to be less. Or the government says, if you are, law abiding when you're driving, et cetera, et cetera. I mean, and then of course, uptake from the people, if they are going to, which is the culture piece that Teemu is talking about. I think this is a great project and will have enormous impact, could have, if there is uptake. But you need many different pieces like government policy, insurance companies, the people, their families.
Private sector.
Yeah, private sector, technology, etc., etc.
Yeah. I have, it's because here the people talk numbers. Really, it's cruel to say about that, but it's true. It's a real, it's a fact. People are numbers. For this reason, I made this provocation, but I need to work in these projects because it's very important here in Latin America. It's cruel to talk about that, but
so let's give you an example what happened in the Helsinki region. We have these ring roads, and it used to be that people were not obeying the speed limit over there, but then they put like 30 automated speed cameras over there, and then the speed was dropping. And then there are certain places where there's all the time flashing and people are paying. So that's like a real evidence that you're, the evaluating, okay, automated speed camera, at least in Finland, it was working, that the speed was reduced and so forth.
Thanks, Teemu. Thanks, Eva. Thanks, Tamas.
Thank you very much. I think we've reached the end, right, Teemu? Tamas?
Yes.
Yeah.
Yep.
Thank you so much for being there. And we hope to see you again.
Yeah. And if we come to Brazil, we hope that you have been implemented your solution so we don't have to be afraid.
Okay.
Bye.
See you.
See you. Bye. Thank you.